Pullman Regional Hospital does vibrancy and innovation. If a community wants to look to grow, you better look at what you're looking at for healthcare.
The volume, the number of primary care providers is threatened in the United States. At the same time, we look and we see that the need for primary care is increasing. So there's an increasing need and a decreasing availability. This residency program helps us to address that so we can see the availability of care increase with the growth in population.
A lot of doctors end up practicing where they trained, and to bring in more medical students and residents, that could make a tremendous impact for the community.
We have students that are from Pullman right now that are in the Elson Floyd School of Medicine, and they're up there training, and they want to know 2 years from now, 3 years from now, where can I go and finish my training? A residency is kind of the finishing part, where a general doctor becomes a little bit more specialized.
A resident is a real doctor. They've completed all their training, they've taken a qualifying examination.
And so by the end of their 3 years, they're working 4 or 5 half days a week in the clinic. And in addition to that, they're doing their inpatient OBGYN or inpatient internal medicine and doing that on top of that.
To do that, they need adequate training in a hospital setting. And in order for our family practice residents to meet the accreditation body's number of patients required to treat in a hospital, they're going to have to touch almost every patient that gets admitted to the hospital.
There's a huge amount of startup costs. The body that accredits residency programs does have specific requirements for family medicine. There has to be at least 2 exam rooms for each resident. There has to be a conference room. There has to be a library. There has to be a big room where there can be group visits. There has to be separate signage for the clinic outside of any other clinic. The program really has to be in place.
I envision having more physician providers walking the halls of the hospital, interacting with nurses. I expect them to be an active part of the medical care team.
At the end of 3 years, they're licensed, they can go out and they can practice.
I believe Washington State University is the right partner for this program. It's part of who we are in this community here on the Palouse. It'd be a shame if we didn't take advantage of the medical school founded in our backyard.
Having this residency in the community gives us a competitive advantage in recruiting in the long term.
One of the significant issues with physicians is burnout. A teaching program will help us with that. It'll help us stay stimulated and excited about what we're doing. That's important now. It'll be more important in the future.
It's important that we make decisions today that will ensure that we can recruit the medical professionals that will take care of us in the future.
As a future doctor, I want to learn and grow in a place that provides opportunities for me that I wouldn't get to see anywhere else.
If those recruiting pipelines kind of stop happening, obviously we won't attract the best. And I've lived in this town long enough to know that at times a better option was to travel up to Spokane or maybe travel to Seattle. And I would hate to see it go back to that.
We have the hospital we have today and the care we have today because 20 years ago people were willing to invest in a vision.
I want there to be great physicians who are here to take care of me, to take care of my loved ones, my neighbors, my friends in the community, and I want every patient to feel that, and that's the legacy that I want to happen here.